everybody.
Good morning, my lord.
Good morning, Mr. Caskey. Now, what do you have for us today?
I have two witnesses this morning for you, the first of whom is Shona Wallace, and I'll ask that she be brought in.
Thank you very much. Miss, Mrs.?
Mrs.
Mrs. Good. Thank you. Now, good morning, Mrs. Wallace. Please have a seat. Make yourself comfortable. Now, when you're ready, Mr. Caskey.
Thank you. Would you tell the inquiry your full name, please? We already have your address and your contact details. You have provided a witness statement for the inquiry. Have you read over that?
Yes, I have.
And are you content that the statement is true?
I am, yeah.
And do you want Lord Brailsford to take that into account when deciding matters? Just for the record, the witness statement is reference SCI WT 0362501. Okay. Now, in relation to the hearing today, there are no restriction orders in place regarding the evidence that you give. So nobody is being made confidential. We're here today to talk about your daughter. Can you tell us her name, please?
Claire Wallace.
And I understand that Claire has a congenital condition.
Correct, yeah.
Okay, I'm going to ask you about her condition in a moment, okay? But before we do that, can you tell me about Claire?
Claire is now 32. She's lively, chatty, knows her own mind, very determined, loving. She just loves family. She loves being around people. She likes to get outdoors. She loves to go shopping, out for meals. She just likes to be doing all the time.
She has a learning disability.
She does. Does that have any physical impact upon her? No, she's fully mobile. She's small. She's only the size of a 10, 11-year-old, but other than that, no.
Can she dress and wash?
She can do most of it herself. She needs help just to make sure she's doing things properly, and support, just guidance and prompting. And
what about her communication?
Her communication is quite good. She can read a few words. She sometimes misunderstands things, or she has to be given short instructions. Yeah, I think.
Okay. Yeah. One thing that's quite common in people with learning disabilities is that they are very suggestible.
Oh, yes, she'll tell you what she thinks you want to hear. Yeah.
Right.
She's very good at reading body language.
And give me just a second. I'm going to jump back and forward. Tell me about social work involvement with Claire.
There has been some social work involvement over the years, and obviously when she went into the care home, she needed a social worker to put a package in place and things. But there's not monthly involvement or anything. It's reviews and when guardianship orders need renewed and things.
I'll ask you about the guardianship. Tell me about the guardianship order just now.
I have welfare guardianship for Claire. It was last renewed in April 2021 for 10 years.
And when did you get that?
The initial one would be when she was 18, when I could no longer make decisions on her behalf.
And why did you get it?
Just because legally I couldn't make any decisions, and she was unable to make them, but mums don't count. You've got to have the legal bits of paper.
Prior to the pandemic happening, what was the impact of having a welfare guardianship order in place?
I mean, Claire wasn't aware that I would be making decisions on her behalf or anything. I mean, it was just really, I'd manage her money, I'd, just organise.
What about if you were dealing with outside agencies, social work?
Yeah, obviously social work or any appointments. I mean, she can't manage any of that herself. I would be doing that, yeah.
Right, and so decisions in relation to that, would those decisions be taken by you?
Yes.
Okay, did that change?
It did change, and appointments were cancelled and things without, I was told after they were cancelled.
And who was it that was doing the cancelling?
The care home manager.
And presumably also you took decisions for her?
Health.
Yes, yeah.
Doctors and dentists.
Yes, it would be me that would take her to these appointments most of the time, yeah.
And decide whether she should have them.
Yes.
And in terms of the care home, she wasn't sectioned into the care home.
No, it was voluntary. Yeah.
When she was a child, did she live at home with you?
Yes, she lived at home with us till she was 23.
23.
Yes.
And then, how did that change? How did the change come about?
Obviously, Claire was quite well supported at school, and then went to a local college. And then it was a day centre 4 days a week with a few hours of direct payments. But what I found was other people were doing the nice things. They were taking Claire out for meals and doing things, and I was left with the personal care, the washing, the shopping, the doing all these kinds of things, and I wanted to flip it over and me do the nice things. And her sisters were leaving home, so it seemed the natural time to do that.
Tell me about her sisters. How many are there?
There's two younger sisters.
Two younger sisters, and how much younger?
3 years younger and 5 years younger.
Right. So she lived with you until she was 23, I think you said.
Yes.
And you reached the point in your life where your younger daughters were in the process of leaving home. And at that point, what was decided in relation to Claire?
I mean, I had been saying since she was 18 that we wanted her to have some degree of independence and not live at home with us forever. So we started to look for somewhere for her to stay.
And where did you select? Where was it decided?
So I'm allowed to say the name of the care?
Yes.
Yes, Abbotsford Care Home in East Wales.
And can you explain physically what that place is like?
There are 3 units. One unit is for people with learning disabilities, younger people, and it operates independently from the other 2 units. There's no cook or cleaner or anything. The staff and the residents, it's like a home. So the staff do everything for the residents in that unit.
And how many residents are there in that
11.
unit? Sorry?
11.
Right. And are there any nurses in the unit?
No, there are nurses in the adjacent units that could be called on if they needed to be.
So a nurse might come through from an adjacent unit.
Yes.
If a nurse was required. I'm talking about pre-pandemic.
Huh.
Tell me what your view was on the care home.
I was happy. Claire was being well looked after. She was happy. She had lots going on. She was out at lunch clubs, and they would take her bowling, and she would go to her day centre once a week. She had a very full life.
And then the pandemic happened. Okay. Now, your statement indicates towards the end that you had some involvement with the Care Commission.
The care inspector, yes. I'm an inspection volunteer.
You're an inspection volunteer. What does that involve?
We go out on inspections and speak to residents and families. I don't see any paperwork or I mean, obviously you have to speak to the staff to see who you're going to speak to, but you don't actually, you don't speak to the staff. It's purely to get to hear what the residents and the families feel about the care home.
And do you feed that back to the care inspector?
Yes, to the inspector, and then that forms part of their report.
Right. And was that something that you found a useful, rewarding exercise?
Yes, yes.
So you had experience of a number of care homes because of that?
Yes.
Okay. Now, in about February, March 2020, so this is just before lockdown happened, did you take Claire away somewhere?
Yes, we were in Florida for a 3 weeks holiday.
You were in Florida for 3 weeks. And did that straddle February, March?
No, we came back just before, can't remember. Well, we came back on the 3rd of March, yeah, I have got the date there, yeah.
Right, so you returned on the 3rd of March, and by that point, generally, lockdown hadn't happened.
No, but I mean, obviously we'd seen the news and things when we were there, and we could see what was happening, but we didn't foresee what did happen.
Although you had taken Claire to Florida for 3 weeks, what was the general pattern up to that point between Claire staying in the care home and staying somewhere else?
She would come and stay with us at the weekends. Sorry?
Every weekend?
Most weekends, yes. I would generally pick her up at 10, 11 o'clock on a Saturday and take her back about 7 on a Sunday.
Right. So she had the Saturday night overnight, and would that be a normal routine for Claire? How did you become informed that lockdown was happening?
I had an email from the provider.
So you got an email, and do you recall what that basically said?
I mean, I just outlined what was happening with the pandemic, and they actually closed their doors a week before the government said they had to. And then I was allowed to take Claire for that one drive in the car. I think I've got the date, it was the 21st of March. I was allowed to take her out. And I think they really did that to give me the opportunity to try and explain to her what was happening.
Was there any differential treatment or different treatment for people within the care home, within the unit, the 11, or was everyone dealt with the same way? Everybody
was dealt with the same way, regardless if you had one visitor every 6 months or you went home every weekend.
Right. At the time you were informed about lockdown, what was your reaction to that?
I could see why it was happening. I could understand, and I didn't think it was going to be for a long time, so I really wasn't that concerned.
Just to help Lord Brailsford, I'm now at paragraph 41 of your witness statement. Can you tell us about window visits? The
first window visits, Claire's bedroom window is right at the entrance to the care home, so I had to walk past her bedroom window to walk round the building to go to the dining room window for my window visit. I'm only 5'3". The window was quite high up because it was hard to see her. She was looking like down and I'm looking up. There was no privacy because it was in the kitchen. It was the dining room window. Kitchen's attached to the dining room, so staff were in the kitchen. I could hear noise. I didn't know how many people were there and could hear everything. There's three residents' windows overlooking where I was, and then the manager came through to tell me how well Claire was, and
Were the window visits time limited?
Yes, 30 minutes.
30 minutes?
Yeah.
So if the manager comes through to speak to you, do you get that time back?
No.
No. No. So if the manager speaks to you, you've lost time with Claire?
Yeah.
Okay. At paragraph 44, you talk about the 7th of April.
Yeah.
Can you see that? Can you tell us about that?
By
Well,
this,
sorry, let me just read that. On 7th April, I had a window visit and saw Claire from the car park through the window. I had to be 2 metres from the window, but I remember the window was open at this visit. So we were able to have a conversation. Tell us about that.
That felt strange, obviously, because there was, her window was there, and then there's the ramp going up, and I was behind the fence. She couldn't understand why I was so far away from her. And she's shouting out the window, and I'm shouting in, but it didn't feel satisfactory. But at least we were now at her window, and there was a little bit more privacy because there was nobody else in the room beside her.
You talk in paragraph 46 about having to stand 2 metres away from the window and wear a mask.
Yeah.
Initially, the windows were open, and then eventually they were closed.
Yeah. I don't know why I was wearing a mask 2 metres from a closed window to try and communicate with somebody with a learning disability.
In terms of trying to find a workaround, did you use any equipment to try to speak to her?
Eventually, well, we did use phones eventually, yeah. They had an extra phone line, and I was able to, a mobile phone, and I was able to phone that mobile phone and then speak to her.
So what, the two of you are standing on opposite sides of the window with your phones on speaker?
Yes. Yeah, but then obviously you had to stand back because they were crackling and all sorts.
Mm-hmm. Were you able to hand things in for her?
Yes, but they had to be quarantined, which seemed ridiculous because I wanted to do normal things to us would be to. There was little conversation because Claire wasn't doing anything. So what do you talk about? You talk about what you're actually doing at that time. So normally you would go and you would have a drink and a cake or something and talk about what you were doing. So all I wanted to do was hand in maybe a bar of chocolate. She'd eat her bar of chocolate, I'd eat mine at the other side of the glass, and we'd talk about how we were enjoying it. But despite the chocolate being double wrapped, it still had to be quarantined. She couldn't have it, and it just seemed very unfair.
When you were handing things in, a bar of chocolate, for example, who would you physically hand that to?
A member of staff.
And would they be wearing PPE?
They must have been, yeah.
And so your idea being that they could take the first wrapper off, the inner wrapper would then be effectively sterile.
Yes.
And that would be handed to Claire.
Yeah.
Do you know what precautions the staff in the care home were taking?
I mean, they were going and buying food for the care home. I presume it was all getting wiped down when they brought it in, but I'm quite certain it wasn't quarantined.
Right. Now, I understand that when Claire was younger, around about 10,
Yes.
She had to have an operation.
Yes, she had open heart surgery then, yeah.
Right. And did that require follow-up?
She has annual follow-ups.
And what happened to the follow-ups during lockdown?
They were cancelled, first by the hospital, and then which one are we at? Because I can't, because there was different ones. So the one on the 14th of April was cancelled by the hospital, yeah. And then there was another one cancelled.
And who was that cancelled by?
Which are we at?
Well,
Fifth, yeah. Yeah, they were both cancelled by the hospital, these ones, I think.
yeah. Were any subsequently cancelled by the care home, so far as you're aware?
There was another one cancelled by the care home because they were wanting to test Claire a second time when the member of staff that had been on holiday had tested positive.
Right. Now, paragraph 54, you mention a key worker. Please don't name the key worker, but can you tell us about your relationship with the key worker?
Normally, she would be the person if there was an issue. I mean, obviously, you can speak to any of the staff, but she would be the one that would sort things out that had to happen or mention to me if Claire was needing something. So we had a good relationship.
And what happened during lockdown in terms of that member of staff?
I mean, we still had contact, but yeah, we still had contact, but it was just different.
In what way different?
I suppose she was fearful of saying the wrong things or doing the wrong things, so I had to ask for information rather than it being volunteered.
And why do you think she became reticent at that time?
I just think there was so much going on, and there was so much information, and they were being told so much by different, by their manager, by senior managers, by the government, by public health, by everybody.
Okay. So for someone who doesn't want to say the wrong thing, saying very little is a good strategy. Is that right?
Yeah.
Paragraph 55, you talk about a photograph on Facebook of Claire. Tell us about that.
I saw a photograph of a member of staff, and it looked like Claire was reluctant to be next to this member of staff by her body language. The picture was subsequently taken down, but then it made me a bit, I don't know. By that stage, my anxiety was very high. So I then felt, were all the photographs staged? Was everything, were photos being taken to keep relatives, to make relatives think everything was good, and maybe it wasn't.
You then talk at paragraph 57 about a garden visit.
Yeah, that was
Tell us about that.
Major low points of the whole. So the garden visit was arranged. It was in a gazebo just outside the main door. So I was given my instructions, my PPE. I was sat in the gazebo, and then I had to wait on Claire being led out by the hand. And there was a coffee table between us and then the two chairs, and the member of staff sat beside her with her hand on the arm of the chair to make sure that Claire wasn't going to break any social distancing. So obviously the whole 30 minutes was supervised and timed very exactly. Claire wasn't herself. She wasn't answering my questions. She was looking to the staff to answer the questions. And to have that, it's such a natural interaction for us. At one point she drooled, and to see her sitting there drooling and to be, to have a tissue in my pocket that I could have wiped her chin and not be allowed to do it was just awful. The visit came to an end, and it was like, well, say goodbye to Mum, and she was led away, and well, I was frankly a wreck.
Tell me about frankly a wreck.
I don't actually know how I walked from there to the car, but I certainly never left the car parked for at least 30 minutes, and I don't remember much of my journey home.
Right. Were you safe to drive, do you think?
Probably not. No, yeah.
You okay?
Yeah.
Good. Okay. So, I think relatively soon after that garden visit, you took some fairly significant steps in relation to Claire. Can you tell us what that was?
I decided that she was coming home to stay with us. She couldn't be living like that.
Right.
We couldn't be apart.
And she wasn't sectioned or anything like that?
So, I mean, that was the care home were okay about it. They were supportive. They could understand the reasons. But they did say, we can't guarantee that she can walk back in.
Right. Well, we'll come back to that. So up until this point, you're seeing Claire at a garden visit, wearing PPE, and very time limited. Mm-hmm. But you have the ability just to take her home.
Yes.
And is that what you did?
Yep.
How long did she stay at home?
So that was in July, and it was September, 29th of September till she went back, yeah.
So almost 3 months.
Yeah.
2 months. Did window visits resume? When she went back in?
Yes.
And did anyone else have window visits with her, apart from you?
Yes. Well, my husband was with me. And then later on, her sister was able to go and her grandparents were able to go. Yeah.
Right. At 75, you talk about the rules changing.
Yeah.
Tell me about that communication.
Well, obviously, I was watching for any rule change that happened, and I would be instantly on the phone, but they would have to wait till senior management issued them with new guidance.
So you were more up to date, as it were, than they were?
They had, to be fair, got the information at the same time, but they couldn't do, the care home could do nothing with it until the senior managers had decided.
Mm-hmm. Or at paragraph 76, you talk about a phone call on the 9th of November. Again, don't name the person who made the phone call, but tell us about the phone call.
I had a phone call from a member of staff telling me that Claire had been really upset and she'd never seen her as upset before. And that rang alarm bells, and I felt that she had done that off her own back, that she had decided that no, this, we can't ignore this. We have to phone our mum.
And what was the consequence of that?
I was able to have a window visit that afternoon.
And what did you find?
Claire was just not herself at all. She just, she pulls at the necks of her T-shirt. That's her anxiety thing. She twists it. She was doing that. She just hardly spoke to me. She normally wants to know what everybody's doing. If I'm visiting her, it's where's Dad, what her sister's doing, what her grandparents. Questions all the time, and she just wasn't doing that. She just.
Did you ever find out what the problem was? What had made her so anxious? No,
I don't know what had caused that day. I don't know if it was a realisation that things weren't changing. Her sister had moved house and things, so she knew that things were happening in the outside world that she was not part of.
And what impact did that have on you?
Well, no. I was just devastated.
Uh-huh.
Yeah.
Was that because you were powerless?
Definitely, yes.
Mm-hmm. At paragraph 81, you talk about the first indoor visit.
Yeah.
Tell us about that.
So the first indoor visit was held in the foyer, which is actually out with the unit that Claire stays in. So the residents of that unit had been confined to their own unit until these visits started. Then they were allowed to go through an internal door into the foyer for the indoor visit. The table was longer than 2 metres, and she's at one end and I was at the other, and strict instructions not to move. The main door, there was a sign on the main door to stop anybody else entering because we were obviously having the visit. But then there was the corridor behind me where staff were going back and forward and could overhear everything. Again, it's just, you don't naturally sit that distance apart from my loved one. And all we could do was talk, and she had nothing to talk about. And I obviously was being very careful what I told her, because I didn't want to tell her that I could meet a friend and go for a walk when she couldn't do these things.
And so at the time that this was happening, lockdown in the outside world had diminished to some extent.
Yes.
But not within the care home.
No.
Does Claire, apart from, you've told us about her requiring checkups for her heart surgery 10 years ago, or now 20 years ago, does she have any other general health problems?
She has an eye condition that's monitored as well, yeah.
Was she any more at risk from COVID than you or me.
I don't think so, no.
But you were able to go out and meet people.
Yes.
And we need to take it out of the live stream, so that will take about 5 minutes. So can we have a 5-minute adjournment?
All right.
I apologise, and I apologise to you also. It was me that started it.
Well, it was actually. I don't think we'll hold you terribly culpable. Well, that's the first hiccup we've had in 3 weeks, so I'm sorry about it, but it seems to be only 5 minutes.
for break took longer than expected.
Now, do we have someone to get Mrs. Wallace? Do we have someone to get Mrs. Wallace?
Can you
Thank you. It's
get
very
Mrs. Wallace?
Yes, it's done. Sorry, it's done. I have the all clear. We can start.
Okay, so we can name the care homes and the care facilities, that's fine, and clear.
Well, I'll just avoid them all. No, just leave it there.
Right. Sorry about that, Mrs. Wallace, but we're ready to go again. Good. Yes, Mr. Caskey.
Thank you, my Lord. When you're going for a window visit or a inside visit, tell me about the testing that was done.
Initially it was PCR testing, so I'd have to go 48 hours beforehand along to the care home and be tested by one of the nurses. And then we moved to lateral flow tests that the nurse would do at the care home, and I'd sit in the car park for 30 minutes. Then they trusted me to do it at home, and I just had to send a photograph of the negative test to them.
And in terms of the geography of the care home, if you're going to get the PCR test or to pick up the lateral flow test, where is that in relation to Claire's?
About 20 minutes from our house.
From your house. And then when you get there, what about Claire's room? Where was that?
So I would be walking past her, her window would be here, and I'd be walking up the side of the building to go to have my test, but I wasn't to have any interaction with her. So
you weren't supposed to have any contact or any
no,
through the window contact?
No, I was just there to have my test, yeah.
So did you go into the building?
I did go into the building, but not her unit. Again, this foyer area that the other. So there's the one. Her building sits with an internal door to the connecting building where the other two units are, where the foyer area is, which is where I would go to get tested. I can't imagine how that was for her if she could see my car in the car park, because she would recognise my car.
And presumably if you're walking past her window, then she could see you some of the time as well.
Yeah, I would wave, but if I thought she was there, but I think she was probably not in her room at these times.
Right. At paragraph 81, you talk about an indoor visit.
Yeah.
Can you tell us about that?
At that point, I was allowed the indoor visit in the foyer, wearing full PPE and sitting at the other end of a very long table opposite Claire. And that was the main door. Was there was a sign on that to stop people coming in, but staff were moving about behind me and could hear everything we were saying.
Now, you explained that to us earlier, and you said that the contact was unnatural.
Yes.
And you also said that was because Claire didn't really have much to say to you.
That's right, yeah.
Did you ask about that? Did you do anything to try to make that a bit better?
I was asking to play games, if I could play a game with her or something, so that, because that's what she enjoys doing, is could I not bring dominoes and we can clean the dominoes and we can still play or something, but that wasn't allowed. Eventually I was able to get paper and pen, so I would make up silly games when she's got her bit of paper and pen and I've got mine. We would make up bingo games or, both write down a number and see if we got the same number, just silly things to try and amuse her.
For the 30 minutes?
Yes.
You had been taking her home every weekend
Yes,
for, I think, 36 hours roughly.
yes.
What happened during lockdown in relation to those visits?
But there was no home visits until, I can't remember what the date was when we were allowed to have home visits again.
Now, we're getting up to Christmas in 2020, and I think we have Claire's date of birth. Her birthday is when?
The 19th of January.
Right. So, in the lead up to Christmas, did you take Claire out of the care home?
Yes, I did, because there was no way she wasn't spending, and she'd spent every other Christmas with us. There was no way she wasn't spending Christmas with us. And I said at that point that we would keep her with us until after her birthday in the January. It was her 30th birthday. When you have a child that's been, when they were born, you were told you were lucky to see their 3rd birthday. There's no way you're going to miss any birthday.
There was a point at which she was due to go back but couldn't. Can you tell us about that?
She couldn't go back because there was COVID in the care home.
How were you notified of that?
By email.
And was it just she can't come back?
Well, no, that I had an email to say that the care home was, public health had closed. Yeah.
Right.
So then I was reluctant to send her back or take her back.
Was there communication around about that point between yourself and social work?
Yeah, that was when social work, I mean, I'd never heard from social work throughout the pandemic until this point, but they said that if she didn't go back almost immediately, then she would lose her place. So my hand was kind of forced at that point.
And she did go back?
Yes.
When was that? I think I'm looking at paragraph 91.
So that 15th, was it the 15th of March then? Yeah.
Yeah. So she had been out since, I think, the 18th of
December.
18th of December. This is now the 15th of March.
Yeah.
Does she need to get tested to go back in?
Yes, they had to send someone to the house to test her, and then she needed further testing once she went back.
Okay. Now, at that point, and I'm now looking at paragraph 92, at that point you took some steps to ease communication. Can you tell us about that?
Yeah, but at that point we bought the Alexas to have the Echo Show so that I could drop into her room and speak to her without having to ask staff to take a phone to her. It was difficult because we wanted daily contact, and you didn't want the other residents to see that Claire was getting daily contact when they weren't getting it. So that was a way of us having daily contact without, other residents thinking, why am I not getting, why is nobody phoning me, kind of thing.
And within the care home, I suppose that's quite important that people are treated to a degree equally.
Yeah.
Why was it right that Claire could access that when others couldn't?
They didn't have a relative that was being as proactive as I was.
Right. They weren't as lucky.
Well.
Give me a second. I asked this question more to Lord Brailsford than to yourself. Do you know how the technology that she's talking about works?
Or several, in fact, in various places.
Sometimes, it's a kind of...
You're quite right, but it happens that I do know about this one.
It's a who are the Beatles moment. So.
I've had those.
Now, at paragraph 99, you name another member of staff at the care home, and I would like you not to do that. But can you tell us what the rest of that paragraph is about?
That was about an appointment being cancelled without asking me first, because a member of staff that was on annual leave had tested positive. Obviously, I do not know who that person was, whether they were a person that worked in Clare's unit or one of the other units. I don't know.
And you say in paragraph 100 that you took that to the social work department. Tell me about your communication with the social work department.
I just felt that, as welfare guardian, it should have been my decision, and at that point she should have been able to go for appointments. But the social worker just deferred to the care home manager. And
then at paragraph 101, you say something more generally about deference to the care home.
I just feel that the care home manager, the provider, nobody would challenge them at all.
And why do you think that was?
I don't know, really. I can't.
No need to guess. No need to guess. Paragraph 103, you talk about taking her out from the care home for a walk.
Yes.
But the care home are saying, well, you can't touch her.
Yeah, well, I was still meant to maintain social distance as much.
And how do you respond to that?
Well, I obviously wasn't going to let her run out the road in front of a car, but I did try to maintain distance, which again wasn't natural, because she would hold my hand normally if we were out for a walk.
Yeah. So. And then at paragraph 105, you talk about something that you think was a big mistake.
Yeah, I got a message from the care home asking me, or telling me that Claire had had a taster session with a therapist that comes into the home, an aromatherapy session.
What kind of therapist?
Aromatherapy.
Aromatherapy.
Well, yeah, that's what she was doing, yeah. And that Claire had enjoyed it, and they wanted me to authorise payments for further sessions. So, I mean, I was just distraught. You know, somebody else could touch her and I couldn't, and this person was the same as me. They didn't work in the care home generally. You know, why could someone else do something I couldn't do? I complained, and to be fair, the care home said, no, you're right, you can do that next time if you want.
Sorry, say that again.
The care home, when I complained about it, the care home did say, no, okay, we understand your concerns, and yes, if you want to do that when you're next in, you know, we'll support that.
Right. Paragraph 107. You talk about PPE.
Yeah.
So we're now up to May.
Yes. So I was allowed to, at that point, to take Claire out, and so I think we could have an hour at that point. And I think the first time I went and spent half an hour in a room, and then we went for a walk. But then it was just, you know, I had to go in, and then I had to put all the PPE on, go in her room, take it all off when I came out, you know, and then go for a walk. So it became easier just to meet her at the door, you know, and not enter the care home at all. And I mean, these walks, it was lovely to get out with her and go for a walk, but I can't look at my watch without her realising I'm looking at my watch. So she was worried about the time, and neither of us knew what the consequences were of being late, or because we were told you have an hour.
You talk about testing in relation to that at paragraph 107.
107?
No, sorry, 108.
All right, so this was another instance where I was allowed to take Claire back to our house for a few hours, and that was going to be allowed without her being tested, because if I had already submitted a negative test, and my husband, because we were both in the house, she was allowed to come out for that length of time. But then when I spoke to Claire the next day, she told me she had been tested. Claire can make things up, so I then phoned the care home to check, and they said no, she hasn't been tested. I was like, okay. So then I used the drop-in facility on the Echo Show and said to Claire, you can't do that. You can't be telling mum lies. It's not on. We can't. That's not how it is. You've not been tested. only for the next morning to get, I can't remember, it was a phone call or an email from the manager to say, sorry, Claire actually had been tested. So I had, I had given her a row for something that she was telling me the truth, and it was just, it was just horrible. I mean, the member of staff that did the test felt bad and apologised, but the incident had happened, and the fact that you can't go and give somebody a cuddle and say, I'm sorry, Mum should have listened to you, or whatever, it was awful.
Yeah, I see what you say about testing and the consent aspect, and I see what you say in the subsequent paragraph 110. Did you give at any time blanket authority to the care home to consent
to testing?
Testing?
I did sign something.
So you might have done that.
Yes.
Yeah, fair enough.
Yes.
Yeah.
Okay. Paragraph 121, you talk about a workbook.
Yeah, I was asked if I would complete an infection prevention control workbook, which I believe was the same that the staff were completing, which I did readily. But then it was taken away to be marked, and I said, well, can I have it back and keep it for reference? No, we need to file it. So it just seemed, bizarre to complete something like that and then not be allowed to. I was sitting in the car for half an hour waiting on test results or whatever, just flick through it or, give reference to it, but they had to file it. I couldn't keep it.
Would it have been helpful to you in some way to have it?
That just made more sense for me to have it than it sit on a shelf.
Right. And you say at paragraph 122, throughout the pandemic, channels of communication with the care home remained open and all emails were answered. Claire is still there and is happy. Things have returned pretty much to normal. Yes,
I'm still happy with our care. I mean, when I say pretty much to normal, a lot of the services haven't returned, so...
Well, that's something I want to ask you about. Yeah. Prior to lockdown happening, she was attending day centres.
There was a day centre. She went once a week to a day centre, yeah.
And what else was she doing outside the care home?
I mean, she went with the care home to lunch club Monday and Friday. If she chose not to go, that was fine. She went to the day centre on a Wednesday. They would generally do something on a Thursday, maybe go shopping or bowling, or she could be out during the week helping do the shopping for the unit. So she was out pretty much every day.
Swimming?
Yeah, sometimes, yeah, with the day centre, that would be it.
When you say things have pretty much returned to normal, except for all of those things.
Well, not all of them, but no, they haven't all returned, no. The day centre, once there was a social work review and they said, well, she doesn't need that anymore, so that got scrapped. And like the lunch club was only restarted one day a week instead of 2 days and things.
Yeah. Can I take you to paragraph 130? Can you read that to us?
The units in the care home were not allowed to mix and staff weren't allowed to move units. Yet you were always told we had to stick by the rules to protect the other residents, but there was no mixing with them anyway. So I'm referring to the fact that the frailer residents in the other units, Claire wasn't mixing with them. But we were told that we had to protect everybody. It just didn't make sense.
You talk at 132 of there not being a debrief, as it were, at the end of the lockdown period. Yeah. Has that happened yet?
No, I don't think care home providers have been particularly asked to do that, but I think it might have been helpful to restore relationships.
And have you suggested that to the care home?
No, I haven't.
Now, you say at 133 that there are individual care plans, but that the family form a part of that care plan.
Yes, definitely.
Did that continue throughout lockdown?
not to the extent that it did before. I would say before you would have a balance of Claire in the middle and the care staff and me, so you had a balance, and then the balance just tipped completely the other way, that I fell off the seesaw, didn't I?
Okay. You then talk about Care Home Relatives Scotland.
Yes.
Tell me why that was important to you.
I read an article in the newspaper, which was where I first became aware, and realised that there were this fantastic group of people that were campaigning, and that I could be part of, and people that understood what I was going through. Because by that time, quite frankly, I think my friends and family were fed up hearing me moaning about it all.
Did Care Home Relatives Scotland get fed up hearing from you?
No, not that I'm aware of.
And was that a good thing for you?
Yes.
You've got 2 daughters, and I see from the statement essentially the impact on the 2 daughters was a bit different.
Yeah, just because they're very different. Yeah. So I mean, they both found it hard in different ways, and because one was in Edinburgh and one was in Glasgow, so they were subject at different times to different restrictions, and but I mean, they're very much part of their sisters' lives. One of them's a substitute guardian.
But not the other, and they're aware of that.
Oh yes, absolutely, yes.
Good. Okay. Grandparents?
Grandparents are still fortunate enough to have 2 sets of grandparents. So generally, she would go to the grandparents' house on a Wednesday night for her tea after the day centre. They would pick her up and then drop her off later on, and the other ones quite often took her out on a Friday night. So they were very much involved in their lives, and then couldn't understand how they could no longer see her.
What was the impact on them of the reduction in contact with Claire?
Well, I mean, they were unhappy about it. They couldn't understand. They could obviously, have phone contacts, but it just put more pressure on me, because obviously they were constantly asking me if things had changed, and it was hard for them.
And tell me about your husband. What was the impact on him of this regime?
I was hard to live with. No, I mean, it was difficult for him not feeling as involved. He actually is hard of hearing, so the whole window thing was even more difficult for him as well. It was just...
But as far as you were concerned, there couldn't be any variation in who it was that was doing the visit. It had to be one person forever.
Yeah, but I probably didn't ask because I wanted to be the person.
Right. Paragraph 147. When she comes home at the weekend, who's she supposed to be interacting with?
Normally, most weekends we would go to my parents for lunch on a Saturday. But obviously, she just had to come to my house. And we would visit our other grandparents at some point over the weekend. She would see her sisters not every weekend, but certainly see them, and her aunt and uncle and cousins.
You wrote to the Fife Free Press.
Yes.
We spoke about this before you came in.
Yeah.
And you said you weren't sure if you'd be able to read it.
No, I'm going to read it.
Please do.
Yeah. So I sent this letter after the garden visit that had been horrendous. It was my way of trying to get my feelings down on paper. So I took Claire's name, I made it anonymous. A garden visit sounded better than a window visit, but do you think it was? I saw you twisting the neck of your T-shirt, jiggling your leg and avoiding eye contact. All the things you do at review meetings when you are anxious. You also wanted to get a letter to show me, but you were not allowed to do that. I had a tissue in my pocket, but would have broken the rules if I had given it to you to wipe your chin when you drooled. That made me sad. The whole visit felt like that day, almost 19 years ago. You were 10, when you were going for major heart surgery. Leaving the house in plenty of time, so we arrived well before the appointment time. Filling in forms, although yesterday it was my details that were required for the visitor's booking form. Today it was me that had to have my temperature recorded before the visit could proceed, and you would be allowed out. I wasn't allowed to have Dad there to support me today, though. One designated visitor for 30 minutes once a week is all that's allowed. Like that day, once everything was checked, I began to dread seeing you being led away again. I tried to keep talking to you just as we would normally, but your responses were not the same as they usually would be. I mentioned a relative's new house, but you didn't ask when you could go and see it or them. You seem resigned to life as it is now, because you didn't once mention the bloody bug, or ask when you could come and stay with us for the weekend. In the early days of lockdown, you asked every time I spoke to you. When you were being taken down to the operating theatre, I was able to kiss you, tell you I loved you, and that I would see you soon. But today, I could only blow you a kiss while wearing a face covering. Kisses are magic. They can get through. It felt wrong on so many levels. Let's take a breath. When we were told the time was up and you were led away, hand firmly held in case you tried to break the social distancing rules. I then had to get up and walk to the car, but didn't reach it before the tears started to fall, just like that day so long ago when we had to leave you at the hospital ward. It was at least 20 minutes before I could drive away. Breathing and heart rates returned to near normal. The outcome of your surgery was never 100% certain, so the 6 or 7 hours of waiting was hard for Dad and I. The phone call afterwards and the rush to be by your side, people moving in the corridors to let us pass, and the relief that everything had gone to plan. We could then both be by your side day and night if we wanted to be. Today, you were led away. I knew that the rules would have to be followed, so it would be 6 days, 23 hours and 30 minutes before I could be 2 metres away from you again. Love, Mum.
You then move on to lessons learned. Can you read the first sentence in 151?
Family are not the enemy.
Does that express your view as to what the situation was or how you were seen?
That's how I felt, because we were the ones that were going to bring COVID into the care home.
And then the first sentence of 152?
There was no trust.
First sentence of 153?
Why did it have to be blanket policies?
(154)
The staff initially tried to be innovative, but that stopped. The staff would be tired. Initially, Abbotsford put out things saying they might reach a stage where they may need volunteers because they didn't want to bring in agency staff, which I was all for. I said absolutely I would come and do the dishes or the laundry while staff were doing activities. Then they said no, they couldn't do it, they weren't allowed. I don't know that they weren't allowed.
Stop there. Tell me about the relatives clinics you talk about at 157.
They set up Zoom meetings, relative clinics, so the provider set them up, so it was for all the care homes that they have. It was very much about the statistics, government statistics, transmission rates, etc., and how the staff were doing and how, how well the staff were doing and how grateful we should be, which I am. I will be forever grateful for what the staff did through COVID. That was, can't imagine how hard it was. But it really wasn't about how they were monitoring the mental well-being of the residents or the relatives.
158, could you just read that, please?
They became our residents. They went from being your relatives to our residents. Claire didn't belong to them.
159, you say that you got an email on Hogmanay saying things are changing daily
Yeah.
due to the new variant and how transmissible it was. And that had the impact that anyone going back to the care home after a trip out would require to isolate. Mm-hmm. What was your reaction to that?
That meant if I took Claire home for an overnight stay at the weekend, she'd be in constant isolation because she'd be isolated till the following week.
Can I take you on to 162? Mm-hmm. Where you say nobody was measuring the impact this was having on the mental well-being of the residents and families. What impact did it have on you?
I wasn't sleeping properly. I was anxious. I was going out for long walks and not telling anybody where I was. I wasn't myself.
What impact did it have on your husband?
He was obviously having to try and support me, and he did support me. And most of the time, put his feelings to the side to support me, really.
168, you talk about us. If I'm totally honest, I don't have high expectations of the inquiry, of what the inquiry is going to achieve. I think it's going to be a lot of paperwork, and I'm not sure who is going to pay attention. If they heard your evidence, would they pay attention?
Well, I hope so. But I think having been parent of a child with a learning disability for coming up for 33 years, and had hopes dashed of change and policy changes through these years, I have become very cynical.
I've certainly heard you. Thank you very much.
Yes, thank you very much indeed, Ms. Wallace. I'm very grateful.
Thank you.
Right, take a break, come back and say...
Sorry, sir. I've been asked to ask you to remind those in the hearing room that the witness's husband's name is covered by the restriction order and they can't repeat it.
Right, you heard all that. Yeah, good. Probably forgotten it as much as I have, but there you go. Right, shall we say 25 past?
Yes.
And yes, it's you again, Mr. Caskey.
Yes.
Yeah. Very good. Thank you.
Thank you.
Right. Thank you. Now, Mr. Caskey.
Our next witness is Margaret Kilpatrick. There is a restriction order in relation to her mother, who will be the subject of much of the evidence, and also the family GP.
All right. Miss or Mrs.?
Mrs.
Now, good afternoon. Sorry, I beg your pardon. Good morning, Miss Kilpatrick. Please take a seat and make yourself as comfortable as you can. Right, when you're ready, Mr. Caskey.
Thank you. Would you tell Lord Brailsford your full name, please?
It's Margaret Charlotte Kilpatrick.
And you've provided details, your contact details and your date of birth in a witness statement that you've provided. You also indicate what you did when you worked.
Yes.
What was that?
I worked in HR.
Okay. At what level?
I was director level when I stepped down.
You've provided the inquiry with a statement, and that statement has been signed. Before you signed it, had you read it over?
Yes.
Are you happy that the content is true?
Yes.
Do you want Lord Brailsford to have regard to all of that statement in reaching his conclusions?
Yes.
Now, one of the things which, one of the orders that's in place is an order that we don't name the subject of much of the evidence that you'll give, who is your mother. And we also shouldn't name one of the GPs involved.
Okay.
Okay. I'd like you to tell me a bit about your mum before her care needs arose. What kind of woman was she?
Oh, she was a very strong, determined lady, a great sense of humour, great love of life, learning, education, bit of a force of nature, but a good mum and loved her family.
And she had been married?
Yes, she was.
That was your dad?
Yes.
When did he die?
Dad died in 2011.
Right. And after he died, what happened with your mum in terms of where she was living and so on?
Well, she still was in the family home that she'd been in for about 40 odd years. After about 5 years, health complications meant she couldn't handle stairs anymore.
Tell me about the health complications.
She had osteoporosis, osteoarthritis, she had gastrointestinal problems, I'll put it that way, macular degeneration, she was going deaf, so multiple things.
And what age would she be about this time?
That time she was about 62 kilos, 63 kilos.
No. What age was
Oh,
she?
age. She was, what age was she? She was 80 when Dad died. So between 80 to 85 she was okay. From 85 onwards, that's really when things started to decline.
And that's when the conditions that you've named developed. Did those conditions progress?
Yes, very much so. Her mobility became a real problem because she had been very active. She used to walk a lot. Mum and Dad never drove, so walking was, big activity. And she just couldn't walk. She started needing like a Zimmer to get about, and then eventually she couldn't really go out for shopping or anything. I would have to take her.
Before she reached that stage, what care was she provided with?
Before she reached that stage, she did everything. She was very independent. She did everything herself. My sister and I would, if she needed anything done, we would be there for her. But she was a very independent lady who liked to do things her way. Was
a care package eventually put in place for her?
Care package was put in place following a hospital discharge. And that was by the time she'd left the family home and moved to a flat. The family house had been very high on a hill, not very accessible, and she decided to move downtown where there was more facilities and she thought life would be easier. she came out of hospital and a care package was put in to assist with meal times, really.
Anything else apart from meal times at that stage?
Well, there was to be personal care for bathing, but Mum didn't really like anybody else doing that, so my sister or I would go down and assist with that and do housekeeping and shopping and cleaning.
And over time, when you talk about that, the care package that was initially put in place at paragraph 13 in your witness statement. But you go on at paragraph 14 to say that the care package wasn't really working.
Yeah.
Tell us about that.
Well, sometimes people wouldn't turn up when they should turn up, or it would be different people coming in. Generally, it was maybe 2 or 3 of the same ladies that came in all the time, but sometimes it would just, somebody was ill or on holiday or emergency cover, and Mum didn't like she saw strangers coming into the house. She didn't like people that she didn't know. She couldn't get up to open the door, so they would have like a key access. So she just was unnerved by this. She wasn't comfortable with it.
Right. Now, at paragraph 15, you talk about the process of, or beginning the process of thinking about a care home.
Yes.
Tell us about that. Tell us about the selection process.
We kind of broached the subject with Mum following discussions with the doctor, and there was more and more she was getting very anxious, more and more phone calls, and my sister and I didn't live in the town, so we couldn't be there quickly. So we spoke to Mum saying, if you're discharged, if you're in hospital again, you could be in a situation where you have to go wherever there is a space, and she wouldn't like that. So we were kind of future-proofing, thinking, what could happen in the future. And she said, she was a bit reluctant, but then she said she put on her head rather than her heart that she would look. And there was one particular home that she was happy. She visited it, and she was quite happy to go there. She felt that it was the best if she had to do that move.
Now, at paragraph 17, you talk about your mum having problems with her legs. Can you tell us a bit about that?
Around about June, Mum started this condition with her legs, where her legs became very red and swollen. The doctor thought it might have been cellulitis. I'm not sure what it was, but Mum wasn't able to go to the surgery, and district nurses were coming in to treat the legs with creams and bandages, but it just seemed to become progressively worse. And they kept saying, well, we'll try different things. My sister and I, we thought, because we went looking about to try and find out what it might be, was venous ulcers, and we had a long battle with the community team to get them to listen to us, that this was what we thought it was, and they kept saying, no, don't think it's that. So it gave Mum real problems. Our legs had to be bandaged with big heavy bandages every day. They would fluid weeping out of them. It was quite unpleasant, painful and embarrassing for her.
You spoke about a dispute between yourself and, I'll just say it generally, the doctors.
NHS service.
NHS service, about the nature of her condition. Did that become resolved?
It did eventually on the February of 2020. When we finally, we'd pushed to get a tissue viability nurse to come and see Mum while she was in the care home. And she thought, oh yes, this maybe should be seen by someone else. And Mum went to the local hospital where she saw this vascular surgeon who literally unbandaged all the legs, looked, oh yes, that's venous ulcers, and the treatment will be compression bandages.
Right. And tell us about the compression bandaging. What does that involve?
It basically, it's like a very stretchy, elasticated bandage that has to be applied to ensure that it makes up for the venous failure of the leg. Apparently it's it has to be done properly. It can cause problems.
In general, who does it? Who applies it?
Well, it was a vascular nurse in the hospital, and is the community nurse. It wasn't the nurses in the care home, sort of general nursing. It's like a vascular
A specialist.
specialism, yes. But the community nurses were trained in that.
Right. And you spoke about the care home. Which care home was it? You can say? Yes, you can say.
You can name the care home. It was the Holy Rosary Residence.
Right. And tell me about that. Why was that selected and what was it like? Pre-pandemic.
Pre-pandemic, it's very, very well known in Inverclyde, and it's been there for a long, long time, and it's run by an order of nuns in conjunction with clinical nursing staff. About 15 years ago, they decided to build a facility that they said to make elderly care as good as it could be, and it's almost like a kind of villagey atmosphere. It's got like a small, what they call the town hall, where they put on concerts. It's got a little shop, it's got a cafe, nice restaurant, that the public could go into the restaurant as well, or visitors. Flats were built for people who just maybe needed that wee bit more, almost like a sheltered accommodation. And then they had the care floor for people who needed like more full-time nursing care.
And when your mum went in, did she go into a flat or did she go into the care?
No, Mum was beyond the sort of independent living in the flat. It was nursing care that Mum needed.
Right. And at paragraph 23, you tell us when she goes in.
Yes, 10th of October.
10th of October 2019. And then you tell us something in the next paragraphs about the care home that she arrived in, if I can put it that way.
Sorry?
The care home that she arrived in, you know, without lockdown.
Yes.
And so on. Tell us about that.
Well, it was a pleasant place to be, as care and nursing homes can be. It was very open. There was a lot of volunteers coming in. There was coffee mornings. There was always a sort of buzz about the place. You could come and go. I mean, residents could go out and go and do their shopping, come back in. There was a hairdresser facility there. It was just very much a community.
I just pick up from the name that it's connected with the church.
Yes.
And did the church also have an involvement in the care home in terms of people going in and so on?
Yes. Yes, it's pastoral care. There's a church as well in the premises, which is very handy for Mum.
And it sounds as though it was quite a nice wee community.
Oh, yes.
And was it integrated into the wider community?
Yes, there was a lot of. It's very well supported in the town, and you know we would have their fundraising dances and raffles and Christmas events, and there was always things going on.
Okay, now at paragraph 27, you tell us about a medical review
Yes.
that happens at that stage. What was the conclusion of that review?
Well, this was on the 10th of March, so Mum had been receiving 4 weeks of the treatment for her ulcers, and it was from the nurses who were administering the treatment just to see how things were progressing, and all seemed very satisfactory, and my sister and I were like, at last, progress, breathe a sigh of relief.
Okay, that didn't last very long.
No, it didn't.
Okay. While she's in the care home, even during that brief period, does she take part in the community activities that you've described?
Of her choosing, she could be quite selective. I mean, Mum would be quite happy to sit and read a book or watch some debate on the telly and shout at the telly and giving her opinions. But she would go down for coffee mornings, or people would pop in to see her, or if they were showing a film or something, or there was a concert on.
And what about contact with GPs and nursing staff at that time, either your mum or yourselves?
Prior to COVID, that had not been any issue.
You were able to communicate any concerns that you had without difficulty?
We had no problems. My sister and I would contact the GPs or the nurses or the care home, the nursing staff. No, there was no issue. They were probably saying, oh no, it's them again.
Your overall assessment of the care home pre-pandemic, what was that?
That it was a safe place for Mum to be, where she was looked after and the staff were caring in kind.
And tell me about the staffing levels.
There didn't seem to be any issue. We were not aware of any issues with staffing levels. And they tended to have sort of a lot of long-serving people. They didn't seem to have any great high turnover of staff.
Mm-hmm. And what was happening at this stage with the treatment for your mum's legs?
You mean until...
Prior to COVID?
Prior to COVID. Well, once we'd established that she needed the compression bandages for the 4 weeks, that seemed to be going no problem.
And then it stopped?
Yes.
Why?
Because the nursing staff, the community nursing staff, phoned the home to say they were no longer able to come in because of COVID. That was on Friday the 13th of March.
How appropriate.
Mm.
And so what was to happen? What was the idea as would happen with your mum's legs?
Well, the nursing staff in the home were not trained to apply the compression bandaging, so basically they were told just to revert to the treatment of the cotton wool, cream and bandages, basically to stop the exudate coming from the legs. It was to revert back to the treatment that hadn't been working before.
Right, right. What happened when lockdown started with your mum?
In terms of the legs or in general?
No, just in general.
In general, I last saw Mum on the 7th. I went down on the 17th of March to see her, and at that time it was mentioned to me that the home may be closing imminently, and it was the next day that the home was closed, which meant we couldn't visit. Fortunately, we had a landline installed in Mum's room, which allowed us to keep daily or several times a day contact. We could phone Mum and Mum could phone us when anything popped in her head.
And prior to lockdown happening, how often were the family going in to visit her?
Oh, well, my sister and I would be down like each couple of times a week. Maybe every second day somebody would be in, or grandchildren going at the weekend. So she had frequent visitors.
Was she able to move around when lockdown started, move around the care home?
As far as I know, yes, she was. But if there was any outbreak, you were not allowed to leave your room. But as far as I know, she could move within the home, but she obviously couldn't leave. But there were times when they were restricted to their room, and also the dining, people going to the communal dining room, that was stopped and people were being fed in their rooms individually. Right.
But she was still able to move around the home some of the time?
Yes,
Okay. And did you notice any impact of the restrictions at that stage on your mum?
Only my contact was purely on the telephone, so she would just say, I'm not listening to that television anymore, because all I'm hearing is how many people have died today, don't do this, don't do that. And she said it just, life was miserable enough not seeing her family, but to be told she didn't want to hear that. So she kind of withdrew a wee bit from what was going on in the outside world.
And was that unusual for her?
Oh yes, because she liked to know everything that was going on. She was liked to keep up to date with the world.
And did that impact on her view or her approach to the family? Did that become more withdrawn?
She was still very keen to speak to us, but she didn't have as much to speak about because her life was more or less becoming confined to four walls.
Okay, in terms of communication, I'm now looking at paragraph 41. In terms of communication with the care home, tell us a bit about that.
We could contact them when we could phone the care home. It wasn't necessarily always easy to get hold of people because they were obviously very busy, and I'm sure they were probably struggling to get staff as well. I mean, I know there was people who stayed in the care home, but Yeah, we could phone, and eventually you would always get somebody who would speak to you and answer any questions, and I could get emails. They would send out email updates, maybe about...
I'll ask you about those in a second, but you said there were people who stayed.
Yeah, sometimes they had, like, rather than, to make sure they had staff there, they stayed in the accommodation.
The staff stayed in the accommodation, yeah.
And they would send, like, they had a wee bus that would go round to pick staff up, so they weren't having to rely on public transport. They were trying to do things just to keep things well staffed.
Did your mum get shielding letters?
My mum had frequent shielding letters. Every few weeks or months she got letters telling her how she was in the most vulnerable group and how they were very concerned for her and how she must shield and be kept safe.
Mm-hmm. Was there any recognition in those communications that she was in a care home?
Only the address to which it was sent, but there was a very broad brush of detail about trying to avoid meeting people, limit your shopping, limit your social contact. It didn't really cater to people who were in a nursing or care home.
In your statement at paragraph 41, you say it was a one-size-fits-all. Tell me why you came to that conclusion.
Well, it seemed to be you can't meet people, you can't go out, you can't do this, but with no cognizance of people who are confined to a care home with the feeling they had no control or no say in what was happening to them, basically almost locked up.
You're talking about, in the next section, about isolation. Could you read me the last sentence in paragraph 42?
42, the last sentence. The last sentence, it was just a big blanket guideline.
And is that your view of the information that you were given, or that care home residents were given?
From the external sources?
Yes.
And people in care homes my mum had mental faculty. I mean, she was very aware of what was going on, and she found the restrictions very hard. I can't even imagine for people who with dementia or Alzheimer's how they could have processed what was happening.
Sure. You indicate in paragraph 43, you say it had a big impact on mum. The biggest impact on mum was being deprived of the family, of her freedom, and also the doom and gloom and the scare factor that was around. All this affected mum. Can you continue where I've stopped?
You want me to read? There was a pandemic of a virus and a pandemic of terror. There was no cognizance of the fact that a care home is a person's home. Residents were paying for their care, but they were being told what they could and couldn't do. They had no say in what was happening, where money was being taken every week.
You say that the care home was your mum's home.
Yes.
Do you think that was recognised? I'm not talking about within the care home, I'm talking about wider than that.
No. The care home had said, this is your mum's home, yes, and we were to treat it like that. But externally, no. It was almost like you were in an institution and you were just to do what you were told.
Is it Kilpatrick? Read the last 3 lines in paragraph 43. I think you should. I know you didn't do deliberately, by the way. It's because it's over the page.
Oh, is it? Oh, sorry.
No. Just a fairly powerful.
During the first lockdown, my mum said to me it was worse than during the war because you were deprived of your family and community contact. Yes, she did say that. It was at least during the war you could see family and go about your business.
Paragraph 45. There is reference to clinical guidance.
Yes.
And your mum's treatment should have been continued.
Yes.
But it wasn't.
No.
Tell us about that.
This was a document that I found, and it basically was a traffic light system of the treatments that, despite COVID, should go ahead, the ones that were up for consideration and the ones that should be stopped. and compression bandaging was in the category of should go ahead. This treatment should not be withdrawn.
So it was on a green light.
Yes.
But in practice, what happened?
In practice, it was red lighted on the 13th of March.
Paragraph 47, you say there's some recognition of that. The vascular nurse tried to secure alternatives.
Yes.
Tell us about that.
This is a vascular nurse who we had seen on the 10th of February when we first got the final proper diagnosis, and he was very helpful to me. He'd actually given me his NHS card with his phone number to say if he could be of any assistance. And I did contact him. He was no longer in the hospital in Inverclyde. He'd been moved to another hospital. But he said he would see what he could do and contacted the clinical lead in the care home to see if they could come up with something better than the...
And what happened? What was the outcome of that?
Whatever it wasn't working. It wasn't back to the compression bandages. He wasn't able to reinstate the correct treatment. But I think he just prescribed different creams or whatever he discussed with the clinical lead at the home.
And at paragraph 49, you talk about the outcome of that.
Yes.
Tell us about that.
Well, Mum had to go back to these bulky bandages on her legs, and she just found it very distressing and upsetting. It was both legs were bandaged, like, from little legs like that, they were but this size with bandaging to stop all this exudate, and they were very uncomfortable. It was like raw meat. It was horrible to look at.
At paragraph 50, you say something reflecting the severity of her condition. Could you read that?
Mum was in pain because of these ulcers. She was already on morphine and other drugs for her other problems, but there was no additional medication to ease this.
Okay. You then talk about visits. You firstly talk about visits before the pandemic, and I think I've already asked you about that. Is there anything you think you can usefully add to what you've already said?
No, it was a very free. We could turn up whenever we wanted. There was no restrictions at all. It was just like visiting Mum's house.
And then during the pandemic?
Yes. It just basically the doors closed on the 17th of March, and I saw Mum once on her birthday on the 25th of May. That was the next time that I saw, but it was through a window. I had gone down to leave a gift for Mum. I had to leave things to be sanitised, and I was allowed to go round to the side of the building, and Mum came to the window and I waved. And the next time I saw Mum after that was on the 9th of June when she'd been admitted to hospital.
Well, we'll come back to that. In terms of the May, when you saw her and waved to her in May, was the window open or closed?
No, it was closed.
No. Were there attempts? I know you had the telephone, and presumably you were on the telephone all the time.
Yes,
Or at least she was.
Yes, she was.
What about higher tech, iPads, things like that?
My mum was a smart and intelligent woman, but she was not digitally aware. She things like even the mobile phones were a bit of a struggle for her, and she just saw that as like sci-fi gadgetry, and she couldn't really come to terms with that.
Yeah, there are some judges like that as well. Does she then go into hospital?
In June, 8th of June.
Tell me about that admission.
I received a phone call from Mum, quite distressed, to say she wasn't well. They were taking her into hospital, and I spoke to the clinical lead at the home and said that Mum had severe abdominal pain. We were very concerned about her. They'd contacted the GP, and the GP had said, just get an ambulance and go straight to hospital. At that point, I said, I will meet Mum at the hospital. And I was told, well, you'll not be allowed in because of COVID, you will not be allowed there. I phoned the hospital, and they said that Mum was waiting to be seen. They would phone me back when they had some information for me. This had happened in the morning. By the afternoon, I hadn't heard anything. I phoned late afternoon and spoke to someone who told me that Mum was being admitted. She had they suspected she had a tumour on the bowel which was causing a blockage. She needed emergency surgery to remove that, or she would not survive.
And how long was she in?
In the hospital, she went in on the 8th of June and she was discharged. It was either I think it was the 24th of June.
Did you see her when she was in the hospital?
I saw her for 10 minutes on the morning prior to the operation on the 9th of June. When
Was that just you or anyone else?
Sorry, myself and my sister. The consultant who was doing the surgeon, said we could come down and he would give us a brief time with Mum because he didn't know that she would survive and it would be our chance to see her.
Potentially the last chance to see her.
Yes.
You travelled here today with someone.
Yes.
Who?
A husband.
Did he get to see his mother-in-law?
No.
No.
No one got. It was just my sister and I. No one saw him. The grandchildren, no one.
When she had completed her hospital treatment, where did she go?
When she was discharged from
Yes.
the hospital, back to the care home.
And tell me about visits at that stage.
Well, initially it was because she'd come out of hospital, it was a 14-day isolation. We were speaking to Mum on the phone, but she was very tired and quite distressed. She'd had very major surgery and she found it quite hard to come to terms with what she'd come through. But she did say that if she couldn't see her family, life wasn't worth living. What was the point in coming through all that if she couldn't see her family?
And did she see her family?
The manager of the home agreed to allow my sister and myself on alternate weeks. So I would go 1 week, my sister would go the other week for an hour. And we would be kind of, where Mum was on the first floor, we could access it through a fire exit. So we weren't really sort of traipsing through the home. Or if footfall was a word that, we had to avoid any footfall. So they allowed.
Did that proceed in a straightforward way?
For us, yes. I do believe someone complained about the fact that, this had been, access had been granted.
Who did they complain to?
The police.
And do you know if any action was taken?
I believe they did speak to the manager of the home, but they explained that this was for compassionate grounds, and that, as far as I know, was the end of that.
Sorry.
I did have to carry a letter from the home because I lived in a different council area from Mum. I had to carry a letter to prove that I was going to see my mum.
Did you ever have to use that letter? Were you ever stopped?
No.
I think the next thing which happened in terms of lockdown easing was that outdoor visits were allowed. Did that work for you and your mum?
No, not really. No, after the surgery that Mum had been through, and she was very frail and she'd lost an awful lot of weight when she came out of hospital after surgery, and it just wasn't realistic. No.
What time of year was this?
Well, Mum came out of the hospital in July, but it just she felt the cold. It didn't matter what it was like. She always felt the cold. You would go into a room, it was like sauna city.
When indoor visits were allowed, were you able to get in and see her?
Yes.
Was your sister?
Yes.
Did you have to wear PPE?
We had to wear masks, and you'd hand sanitisers and an apron, and you were to sit a distance from Mum, and there was not to be any contact.
So you're going in 1 week and your sister's going in the next week and you're in full PPE.
Oh, yes.
How did that make your mum appear?
Well, she wasn't over the moon about it, and she also was hard of hearing, so if we had masks on, she couldn't it made it harder for her to hear what you were saying, and she was glad to see us. It was almost at that stage you were grateful for crumbs from the table, that you you were able to see her, but it wasn't like a normal visit.
In what way?
Well, I couldn't hug Mum or sit and hold her hand or just be relaxed with her, and you don't normally go in with masks and plastic aprons on.
Tell me about the administrative process for visits. Was that straightforward?
The home actually kind of employed two people who sort of administered the tests, and if you had to phone up and book an appointment to come in, there was like a phone number like the appointment line. And then when you went down to the home and you got to reception, you either went for it. Initially, they were doing the tests. You would go for your test, and then you'd sit in a room till your test was okay, and then you were allowed to go up to the care floor. Or laterally, when you were doing your own test, they would record that.
Did you have to fill in any forms?
Yes, we had to fill in a form every time you visited, saying that you hadn't been in contact with anybody, you didn't have any symptoms of anything. These were, yes, and that went on for a lot. I think that's went on right up to about February 22. I mean, that was right through.
Right. At paragraph 64, you talk about the 8th of June.
Yes.
And your mum being distressed and having to go to the hospital. Now, you say some things about the particular hospital that she was going to being a particularly difficult place, but that's a matter properly unique to her, her experience, yes? She gets taken to the hospital, and then paragraph 66. What does it say there?
Problem at the time, no one from the home was allowed to go with her. She had to go in an ambulance on her own. I said I would meet her at the hospital, but was told I wouldn't be allowed near, which obviously was very distressing for me.
67.
I called the hospital. They said Mum was there, waiting to be seen, and they would call me back.
Right. Now, she then undergoes her surgery.
Yes.
And you're told that when she comes out of surgery, she'll go into the high dependency unit or intensive care. Did you ask about COVID at that stage?
I did. I asked when the ward that she had been admitted to, obviously there was no risk of COVID, and they said, no, this is a green pathway ward. And I said, and when Mum comes through the surgery, she will be in a green pathway ward, and they said yes.
And did she remain in that ward during the period she was in the hospital?
No. The ward that she was admitted to, she had her surgery. She then went to the high dependency unit and was transferred from there on the night of I think it was the 11th of June, into another ward.
And was that also a green pathway?
I subsequently found out, having asked the question, that no, it was the red pathway COVID ward.
And did you communicate with the hospital? I'm not talking about after you found out. I mean, at the time when she's in that ward, do you have communication with the hospital at that time?
I was on the phone to the nurse in the ward just inquiring how Mum was when I asked the question. Don't know why I asked it. This isn't a COVID ward, and she went, no, this is the red pathway ward, which obviously took me by great shock, wondering what my mother was doing in a red pathway ward.
Because she had had no...
No, she didn't have COVID. There was no...
And do you have any idea why she was transferred from the first ward to the second ward?
Apparently they needed the bed from high dependency for someone else, and that was the only place they could find a bed for my mum. I was asked, was she shielding?
Sorry?
I was asked, was she shielding?
And presumably you would have said yes.
Which I was even shocked that they asked the question, because the letter she previously referred to from NHS, the government telling how Mum was shielding and very vulnerable, did make reference to the fact that NHS are aware of your situation and know you're shielding.
So in terms of the communications you were getting from the unit that were dealing with shielding,
yes,
was that joined up with a hospital?
absolutely not.
No. And was that a cause of concern for you?
Of course.
In what way?
Well, we've been living from March till June in lockdown with the fear of COVID, and then my very vulnerable mother, post very major surgery, is put into what I'm told is the Red Pathway COVID ward.
And
she doesn't have COVID.
Did you phone the hospital and ask why she had gone into
Yes.
a red route?
Yes.
And what were you told?
Well, initially, nobody seemed to know why the decision had been made and who had made the decision. I eventually spoke to the weekend beds manager, who just said that was the only place there was a bed for Mum. It was a 4-bed ward. I think there was 3 other people in it initially. 2 had been discharged, I think, on the Saturday. And I said, well, could Mum even be put in a single room rather than being... Well, actually, I wanted her transferred out of the Red Pathway, but I was told that once you were in it, you couldn't be transferred out, even though they assured me that she didn't have COVID and she was perfectly safe. And I thought, well, if you're perfectly safe and you don't have COVID, why can you not come out of this ward? But apparently once you were in Red Pathway, that was it. They did find a single room for Mum, still within the Red Pathway ward.
At paragraph 80, you indicate, you asked if they were sure she didn't have COVID, and they said yes. They said she'd been tested. And at that stage, they were still waiting for results. You then say the situation was confusing. Tell me about that.
Well, this was again back to, all these letters have been told at how she was shielding because she was in the most vulnerable group, and I just can't imagine how the decision was made to choose this very vulnerable elderly lady to go into this. This is the only place they could find her a bed in the hospital.
The answer to this question is yes or no at this stage, okay?
Right.
Did you ever find out who made the decision?
No.
Do you know if it was a clinical decision or another kind of decision?
As far as I was aware, it was a beds availability decision. I couldn't say if it was a clinical decision or not.
Okay. How long was your mum in hospital?
She was discharged on the 24th of June, back to the care home.
Do you know if she was tested at the point at which she was sent back?
I can't categorically say yes, I do, but I would have assumed that she was. Maybe wrongly, but I assumed she was.
You then ask at paragraph 83, there's talk about her weight.
Yes.
And weight for women or for people in your mum's age group with a series of health problems is very important. Tell me about the information you were given about that.
While she was still in the hospital, I'd asked what weight Mum was because, she'd had major surgery. She had been in for almost 2 weeks and hospital food was not the best, and Mum was a very fatty eater. So I knew what weight she had been when she went in, and the nurse told me, she was 63 kilos, which was the weight she was when she went in, which I did find surprising in light of the fact of the surgery that she'd had and the time she'd been in hospital. But no, they assured me that was the case. But on return to the nursing home where she was weighed, she was 53 kilos.
And she didn't lose 10 kilos in the ambulance?
I doubt it very much. It wasn't a long journey.
Obvious in regard to the nature of the surgery she had, which I won't repeat, but I read.
Yes.
Just as a matter of fact,
yes,
there is going to be weight loss.
Undoubtedly, yes. Apparently the scales were correct.
At paragraph 85, you talk about her legs again.
Yes.
Tell me about that.
Well, one of the good things about being in hospital was she was able to get the hospital approved treatment for her leg ulcers. Prior to the surgery, when my sister and I had spoken with the surgeon on the 9th of June, and he was talking about Mum's chances of survival, he did say it was unfortunate that she had this condition with her legs because it made her much more vulnerable to infections, and it would be a harder battle for her. But she did get the legs treated while she was in hospital, and when she was discharged, the arrangements were made for the nursing staff to come back in. Coincidentally, the day that Mum was admitted to hospital on the 8th was the day, apparently, that the community nursing team were planning to come back in to start treatment.
Right, right.
The events overtook that.
Yeah, so when she went back to the care home, were the community nursing team coming in at that stage?
Yes, they came back in. I think Mum went home on the back to the home on the Wednesday. I think it was the Thursday that they came in.
Now, you talk about having contact with the GP, and I'm going to ask you not to name
Yes.
the GP,
Okay.
but there was a hiccup with antibiotics.
Yes. When Mum was discharged from the hospital and got back to the home, both the nursing home staff and the following day when the community nurse came in, they were a bit concerned. They didn't think Mum was that good. Obviously, after surgery, they weren't expecting her to be great, but they had concerns. And they both contacted the GP to say they think the GP should have a look at Mum. Sadly, the message was not passed on via reception in the GP, and it was the following Monday before the doctor came out to the care home, and Mum had a chest and urine infection, for which required antibiotics.
And was there a problem with the antibiotics she was initially prescribed?
Initially, the one she was given was one that Mum had had a reaction to before, but fortunately the pharmacist had picked up, and then that was rectified,
right.
and she did eventually got the correct antibiotic.
Okay. At paragraph 88, you talk about diet and mental health.
Yes.
Tell me a bit about that.
I think when she was after the surgery, Mum was told she had to be quite careful about what she ate. She already was very careful about what she ate, but it became quite a psychological thing, and she felt she couldn't take, like, all her meals had to be liquidised, and she was very limited what she would eat, and it did impact her weight. I mean, latterly, when Mum passed away, she was 36 kilos.
Paragraph 90, you talk about complaints.
Yes.
I think you say earlier in the statement that you and your sister, what's the phrase? You pick a phrase. Aren't slow.
We wouldn't be easily fobbed off. We were quick to fight any battle for Mum that needed to be fought.
I think when I spoke to you, I said you're the kind of woman that no one would take a busted pea packet home to. Did you complain about the problems with her legs?
Yes.
Once you had found out that this was a green-lighted treatment?
Yes. This was the NICE recommended treatment for leg ulcers. And it was with the health and social care, local health and social care partnership we spoke to, because it was constantly hitting our head off a brick wall saying, no, we think this, and it was just, no, this is how we're going to do it. Meanwhile, we were watching Mum suffering and deteriorating while the treatment didn't work. And
what was the outcome, or how far did you take your complaints?
We went to, finally, it was the head of the health social care partnership, and they agreed that yes, things had not been handled properly, mistakes had been made, and they had introduced a whole new kind of protocol of how venous ulcers should be dealt with by community nursing.
I don't want to put words in your mouth, but was it your complaints that resulted in that change of policy, do you think?
Undoubtedly.
And you were able to sustain those complaints, it might be said, because you got information about the red, amber and green treatments.
Yes, but yes.
You want to say some more? Say some more.
No, it was just, we just found it was just a constant battle to get anyone to listen to you. Everyone always seemed to think they knew best and this was how they were doing things.
At paragraph 91, you talk about a complaint about weight loss. You have that.
It was 3 complaints with the health board. It was the fact that she would put into the red pathway, the dispute about what mum's weight was, and the discharge arrangements. On paper, you're given a discharge. This is what happened, but the reality is it does not always deliverable.
In what way?
Well, the accessibility of the say, well, mum, if she requires a stoma nurse, yes, they'll come in, but the stoma nurse, there's one person who covers the whole area, and I believe she was off unwell herself at the time, so there was no backup. Also, you had to go to the hospital. They wouldn't come out to the home, which wasn't realistic for mum. Dietitians were very hard to get hold of. Speech and language for swallowing. Mum had a swallowing problem. It's like, oh, it'll be a 6-month waiting list. Don't think
For a woman who was 89?
Yes.
You ultimately complained about at least one of the complaints to the public sector ombudsman. Tell me about that process.
That was a soul-destroying process. Again, when you first made contact to them, they were working, the offices were closed and it was limited hours because they were with COVID restrictions. I was allocated a person who was dealing with my complaint, who took an awful lot of information, was very positive, and then they were on leave of absence. After 3 months, when I hadn't heard anything, I contacted them again to be told that, oh, is nobody dealing with your case? And it's been kind of on a shelf somewhere. I was reassigned a new person, and to be honest, I had really no contact. He picked up from the information I'd already provided, never asked me any further questions, no further contact, and maybe every 6 weeks or so, about 4 o'clock on a Friday, I would get an email from him saying, I'm still pursuing the case, I will be in touch in 4 weeks. And there was no, and it took about 18 months to get to the end of it.
And what was the outcome?
The outcome was a kind of partial apology. I did ask for, I didn't want a written apology, I wanted a verbal apology. I got a written apology, which seemed as if it had been put together by committee. They then said that there was an amber pathway that mum was actually in. It wasn't a red pathway, it was an amber pathway, which was completely news to me. I'd never heard it referred to until I got the apology. The staff in the hospital didn't, they only referred to red and green pathways, but apparently this amber pathway was what mum was in, but I still don't quite understand. You either have or you haven't got COVID. So what was the amber pathway for?
You then say something about the care home and infection control and testing. Paragraphs 9 to 8 through to 103, and then on to inspections, and again information about the care home. Reading those paragraphs together, along with the other parts of your statement, it seems to me that you had a genuinely positive view of what the care home had done in terms of care.
I had great sympathy with the care home. They were in a very difficult situation because I think it was like a constantly changing set of instructions or information and rules that they had to abide by. And I think they tried their best for the residents, their families, keeping the staff safe, but it was a hard time for them as well. But any time I had dealings with them or spoke to them, they were helpful to me and mum.
You then say something about lessons learned. you want to just read that? Paragraph 107.
If there was to be another pandemic, I think there needs to be greater thinking about not terrifying people, not this knee-jerk reaction of just slamming the gate shut. I think the
Paragraph, sorry?
I was going to say, they used words like shielding and protection, which sound very soft and we're looking after you, whereas the harsh reality was people were just shut off and isolated.
Was there a difference between the language and the reality?
Yes, yes.
Okay. Paragraph 110. There should be consequences.
Yes.
Okay. You then say something about paragraph 111 about Anne's Law.
Yes.
We know what Anne's Law is. Tell me why you think Anne's Law is important.
Because it would give that right to maintain family contact, which is so important to people. I found it so disheartening that when I contacted my MSP and their caseworker, and that was in February 2022, following a manifesto election promise of Anne's Law, that they hadn't heard of it and weren't aware that there was a consultation. So you think how much importance are people, supposedly our representatives in Parliament, giving to that? Because it is so important that that family contact is maintained and people are not deprived of that.
How would it help?
How would it help? It brings humanity back. It would. I mean, I had power of attorney for Mum. I just felt I had no rights. I was powerless to see my mum.
Okay. Paragraph 112, you say something about us and our human rights-based approach. One of the aspects of a human rights-based approach is that we listen and we give people the opportunity to be heard. Do you think you've had that today?
Today I do, yes. I do feel I've been heard. I have spoken to lots of people for various things and I've had lots of apologies for people, but unless the words are easy, it's the actions that need to be seen. They need to follow through with apologies.
Thank you very much. I don't have any further questions for you.
Thank you.
Thank you.
Likewise, I'm very grateful, Mrs. Kilpatrick. Thank you very much indeed. Very good. Thank you, Mr. Caskey. And I think it's Miss Barami this afternoon.
What time 2.
On at 2, yeah. We're obviously well ahead of schedule. If it's possible that we could start at 2:45.
I do my best.
You're doing very well. If it's possible that we could start at, I understand that there may be difficulties with the witness not being here and so forth and so on, but if possible, it would be sensible if we could start at 2:45.
Yes, the word, I'll inquire about the witness.
Do your best. Thank you very much. So possibly 2:45, but if not, then 2 o'clock. Thank you all.
Thank you, sir.